Let's talk about the branches of the axillary artery in a simple, easy-to-follow way. First, the superior thoracic artery. It's a small and variable branch that comes off just below the subclavius muscle. It usually travels downwards and towards the midline, behind the axillary vein. It supplies the subclavius, the first and second intercostal spaces, the upper part of the serratus anterior, and the overlying pectoral muscles. It also connects with nearby intercostal and internal thoracic arteries. Next is the thoracoacromial artery. This one is short and wide. It pierces the costocoracoid membrane and then splits into 4 branches: acromial, deltoid, pectoral, and clavicular. All of these lie deep to the clavicular head of the pectoralis major. Now, the lateral thoracic artery. Its origin can vary. Most of the time, it comes from the second part of the axillary artery. It runs down along the side of the pectoralis minor and continues onto the chest wall. But sometimes it may branch from the thoracoacromial, suprascapular, or subscapular arteries. It supplies the pectoral muscles, serratus anterior, intercostal muscles, axillary lymph nodes, and the lateral part of the breast. Then we have the subscapular artery. This is the largest branch in terms of diameter, even though it's quite short. It runs along the lateral border of the subscapularis on the back wall of the axilla. It quickly divides into 2 branches, the circumflex scapular artery and the thoracodorsal artery. The circumflex scapular artery curves around the lateral border of the scapula. It passes between the subscapularis and the teres major to supply the muscles on the back of the scapula. It also takes part in the arterial network around the scapula. The thoracodorsal artery continues toward the inferior angle of the scapula. It mainly supplies the latissimus dorsi and also helps with the arterial supply around the scapula. Finally, we have the circumflex humeral arteries. These vessels wrap around the surgical neck of the humerus and connect with each other. The anterior circumflex humeral artery is smaller. It passes laterally, deep to the coracobrachialis and the biceps brachii, and gives off an ascending branch to the shoulder. The posterior circumflex humeral artery is larger. It travels through the quadrangular space at the back of the axilla, together with the axillary nerve. It supplies the shoulder joint and nearby muscles like the deltoid, teres major, teres minor, and the long head of the triceps.